Well, sleep problems, unhealthy eating habits, migraines, these are just a few of the potential effects of prolonged screen time, that is, on devices, especially for children. Our Shawanda Jones joins us in the studio with advice from a local doctor about what parents can do to mitigate those risks. Shawanda.
Health experts say screen time at home should be limited to just 2 hours or less a day for an adult or a child. But what can parents do when many schools incorporate electronic devices in almost every facet of learning? Dr. Keith Watson offers some solutions. From the West Point Children's Clinic says too much screen time can be damaging.
Excessive electronic use, staring at a screen, causes fatigue. Eye strain, which results in headaches. The fatigue can lead to disturbances in our sleep.
The CDC says kids who don't get enough sleep have a higher risk of obesity, diabetes, injuries, poor mental health, and also attention and behavior problems. Issues with vision, sore fingers and arms, and poor posture can all lead to physical complications resulting from excessive phone use.
Trying to limit our time is harder than it used to be.
How so?
Everything's electronic now. Computer screens were the video games after school, and you could limit, as a parent, you could limit your child, and the recommendations were no more than 2 hours a day on electronics.
According to an article from the University of Connecticut, a 2023 study found that almost 90% of K-12 teachers use some form of technology in their classrooms.
At schools, 8 hours, and they're on electronics for most of school. Trying to limit them to 2 hours is really something you're not going to be able to do anymore.
But there are alternative solutions to limit health risks, according to Dr. Watson.
At least every hour you need to take a 10 or 15-minute break to let your fingers and your hands rest, to let your posture improve, let your eyes rest so you don't get the headaches. Get up and get some exercise, try to get time outdoors. Those are the things that we have to try to do. It's just becoming harder to do.
Insomnia, poor concentration, and other symptoms from overuse of electronics can mimic other serious health conditions like ADHD. Please remember to see your child's primary doctor if you notice any changes in their routines.